Welcome to this year's 2016 Bloodborne Pathogens annual training. We go through this training obviously every year. It doesn't change entirely much. The biggest changes you usually see are those in the different types of diseases out there. Though this isn't exciting and enthralling for all, it is incredibly important and it could save your life, barring we follow the practices that we've been taught since we first got into EMS. So it is important class, important to refresh ourselves on and to try to reinvigorate our practices of keeping safe out there when there's bodily fluids and other things that could harm us and give us diseases. Bloodborne pathogens. Why? Why do we go through this every year? Well, if everybody did what we were supposed to do, probably wouldn't be an issue. If it wasn't such an important topic, we probably wouldn't have to go through it every year. But let's face it, we've all been out there and seen how people don't use the practices we're supposed to. Maybe don't wear gloves, maybe aren't wearing the proper PPE and we just stay with gloves when we really should be upping the ante more and putting more effort into masks, goggles, and other things that will protect other parts of our body that could potentially get hurt, injured, or contract this disease. What we're going to go over today, we're going to go over different infectious diseases that are out there, the common ones we hear about all the time, some of the different nuances of them, how we can transmit these infectious diseases and protect ourselves by knowing how we transmit them, how to prevent ourselves from getting them, standard precautions or our BSI, our standard precautions, depending what era you grew up in EMS, the name has changed, but pretty much means a lot of the same things. What personal protective equipment's out there? The other ways that we can control disease by work practices, engineering controls, things that we can do to protect ourselves besides wearing just our PPE. Like I said, we'll go over some different various diseases that are out there, contagious-wise. Infectious diseases, they're caused by those microorganisms. We call them pathogens, hence the name bloodborne pathogens. Can be transmitted from person to person in different ways. It can be through direct contact, or it can also be through the air, like with our tuberculosis, or respiratory MRSA, or a number of other airborne diseases. Again, knowing how it's transmitted can help us to make sure we take the proper precautions so we don't get the disease. Who has a contagious disease? Good question. It's not stamped on our foreheads. We don't wear bracelets, different color armbands to let us know, hey, listen, that person has AIDS. That person has TB. It doesn't work that way. So we pretend everybody has a contagious disease. So we take the proper precautions. So when we go in, we wear those standard precautions, universal or body substance isolations, and we pretend that person has the worst disease imaginable so we can take the proper precautions so we don't get it. There's no way to know unless they tell us that they have a contagious disease. There are some cues, though, that we can listen for if we get a little bit more astute in listening to or getting some information from the patient. In our sample history, we ask for medications. That can be a giveaway that a person is taking a specific medication for a specific type of disease. The 1,000-point question we used to have on Jeopardy. What were the different drugs that you use if you were being diagnosed with TB and being treated for it? And some of those were the INH, the ethambutol, or the rifampin. Those different drugs, if you saw them on a drug sheet, patient gave them to you as meds, that could be a clue that, hey, this person had that or is going through that. And again, something that we can step back, take a look at that and what precautions we need to take above and beyond our normal. Because let's face it, people are concerned how they're going to be looked at, how they're going to be viewed in the public eye. They could be embarrassed if they have some of these diseases. They're not just going to outright come and tell us. So this is another way that we can find that out and protect ourselves. The best way, however, is to pretend that somebody has the worst imaginable disease and take those precautions each and every time. Now, we just talked about the different ways that people can transmit these diseases. Knowing how they can get into our bodies can also, again, protect us from getting some of these diseases. We have the 4 routes of entry in the body. Inhalation. Okay, so we have a respiratory disease or some type of airborne contagious disease. How do we protect ourselves? Some type of mask. Now, when we asked this question again in Jeopardy, we said, well, how do you protect yourself? We can wear a mask. We can put a mask on the patient, i.e. oxygen mask or a regular mask. We can also wear a tuberculosis type mask, or the N95 masks, and that can help protect us as well. So it goes through our respiratory tract and we protect us that way. Ingestion. Now this is the one that I used to always get a kick out of, and I can remember back when I first started in the fire service, we had to watch a hazmat class, and I sat there and I watched a chief go up to a rail car. He was spewing out liquid, and not only was he like feet from it, he thought it was a great idea to put his hand in it, and then smell it, and then lick his hand. And I said, oh my goodness, people are that stupid? But yes, they are, they can be. I'm hoping none of us would do that. But how else can we ingest a potential infectious disease? Well, we go back to when we were little kids. What did mom tell us to do right before we ate? Wash our hands. If somehow we contract something, we get it on our hands, it's microscopic, we can't see it, and then we go eat a sandwich, we eat an apple, and we don't wash our hands first, we potentially could transmit that disease to that food product and then eat it. Something, again, we think about on a fire or a long period event of some type of emergency. Who comes around? The canteen. And what do they have? All that good food that we really shouldn't be eating probably anyway. But we're hungry, they deliver it to us, we're thankful, we eat it, and do we wash our hands first? Do we not have the potential to have diseases, bacteria, and other stuff on our hands and then eat it? That's one of the ways we can get it through ingestion. Injection. This isn't necessarily, shooting up with a needle or borrowing somebody's needle or getting jabbed with a needle. This could be anything that breaks and cuts our skin and then in turn has some type of disease or something on that. There's obviously needles out there. I've heard stories back in the day. Thankfully, I've never had to deal with it, but paramedics took needles and just jabbed them into the seat cushions. Having sharps around, having lancets for diabetics, going around and helping them get their materials, helping paramedics, there's the potential for injection. And or, don't forget, like I said, getting cut and having a byproduct get into an open skin. I.e., if we're on a car accident, we have that potential where we could get cut by the glass or the metal and then somebody's bodily fluids get into us because we have that open cut. Last but not least, absorption. This is where it actually permeates through our skin. Not much we're going to be able to do. This isn't where we would get a body substance isolation or an infectious disease, but gases can permeate and get through our skin. This is something where we have one of those unsafe, the scene isn't safe environments where we shouldn't be there anyway, but gases can actually permeate through our skin and get into our bodies that way as well. So they're the 4 routes of entry into the body. By knowing how the disease is transmitted, contact, through the air or so forth, we can protect ourselves from avoiding getting that disease. We go with personal protective equipment. These are the many different kinds we have out there. Unfortunately, we're usually stuck on that first one if we get lucky enough and we have people that wear that first one, which is gloves. There are limitations to it. They're the normal protection for any type of EMS provider. We go out, we have our gloves on, it's a basic thing, but it does have limitations. They aren't as durable as some other things. Sharp objects can cut through them. Metal can go through them as far as like cut. They're not that durable to sharp objects. Long nails, rings can also break them down. Sunlight can break it down. Long periods of time with chemicals or water can also break it down. So they do have limitations. They're great for the bloodborne pathogens and they do protect us, but they do have limitations. For in a car accident, one thing that we might think about is if we're going to be in and or around a car, potentially maybe getting some cheap leather gloves. This protection can protect us from those sharps, but obviously it is not going to help us from the bloodborne pathogens because it could soak through. So even if we do have wear leather gloves to protect us from the sharp aspect, we still need to have those rubber gloves underneath to protect us from the bloodborne end. And that's where we talk about those outer gloves. Another thing, and you can see in the picture, is masks. This could be for splatter protection, because we also know not only respiratory wise, but our nose, mouth, ears, and eyes, our eyes, nose, and mouth with the mucous membranes can absorb that blood right into our bodies as well. We don't need that necessarily that broken skin for it to absorb into our bodies. So for splatter protection, as you see this poor gentleman here, having the mask and eye protection for splattering. And think about this. Again, we normally go in with gloves, but what happens if there's a bloodier scene, or this person has a bloody nose, or has blood in the back of their throat? What's going to end up happening? The bloody nose is kind of like a postnasal drip, where it goes in the back of the throat. Then they start to choke and they cough. Next thing you know, they're spraying blood into the air. So we need to think about the scene, and as the potential is there for more bloody messes, bodily fluids coming out, we need to up the ante and get more PPE on. We have gowns. Rarely do you see that, except for maybe if you're going to deliver a baby and you know how slimy they are. You might, if you have time, you might throw something like that on, but you rarely even see that. And again, that's another layer of protection between your body and that bodily fluid coming out. The eye protection, you see a little glass shield on that mask, but any type of eye protection that we should be having on when we're in a motor vehicle accident where we have sharps that could potentially fly out and hit us, especially on a car accident, added to that when it's an extrication and metal's being cut, we should have eye protection on that meets the ANSI Z87.1 standard. This is the shatterproof glass eyewear. If you go to Home Depot, Lowe's, you can get these very, very cheap. You can get them stylish, so you can be styling when you're out there. Sunglasses. You can get the amber ones that brighten things up. I would caution you on the amber ones, though. Great for nighttime work. When it's real sunny out, and it's sunny and there's snow on the ground, probably not a good idea outside. Brightens up to the point it almost gives you a headache. So they have sunglasses, regular, clear. They got amber, all kinds of neat ones out there. Rather inexpensive, usually under $10. Sometimes $5 or $6 at Home Depot and Lowe's. You can go to Harbor Freight and get them even less. So I mean, they're a great investment to protect your eyes. Remember, you only get one set. All right, engineering controls. What are they? Engineering controls are anything that is designed and engineered, hence the name, to control the spread of disease, to make sure that the disease doesn't spread past the containment of whatever the engineering control is. So what are some examples? Well, we have red bags. We're all very familiar with them. They're built or made to prevent the spread of disease, and because they're in that red bag, not only are they decent as far as durability wise, but everybody knows when they see that biohazard sign that's on the screen now and you got that red color bag that this is a biological thing. There's probably blood, probably other bodily fluids in here. We don't want to touch this. Sharps container is another one, made of hard plastic, so when you put those needles or any type of sharp objects in there, you don't have to worry about them breaking that. You can pick the container up and you don't have to worry about needles potentially sticking through. So that's another benefit, or another engineering control. Another one is the vent inside our ambulances, where we vent out the exhaust, or vent out inside the patient compartment. We sometimes use this for TB patients. You have the windows open and have that air flowing through, and that's sucking it back out. So this is a benefit and another type of engineering control, something engineered or built to prevent the spread of disease. And lastly, we see in hospitals and sometimes other places where you have rooms where somebody has a respiratory ailment or a disease, and they want to keep that contained in there. So they actually have like a pressurized room that you have like an air curtain that allows us to keep that air constantly in that room, or at least controlled. So that, again, the spread of disease is minimized. Another thing we can do is work practices. Different policies and things that we have at work that will help prevent the spread of disease. Different policies that, linen must be changed at all times, and something that definitely at Winslow is done. You guys clean like crazy. Anytime I walk in the building, you can smell that, usually smell that nice bleach smell. And I know it might turn some people off, but when I smell that, I'm like, cool. Some type of disinfectant's been going on. Things are clean. Things are sanitized. You don't have to worry about that spread of disease. And there's a lot of people that enjoy doing that down there and make sure that they want to make sure they're not taking stuff home to their families. They make sure they disinfect those longboards. They disinfect the rig, the stretcher, and the rig itself from the different calls that are had where there's a lot of blood and bodily fluids. So work practices or policies mandating that certain things be done. Some other things, hand washing. Obviously, one of the best things we can do is hand washing. Girl Scouts or anybody involved with Girl Scouts know you sing the I think it's Twinkle Twinkle Little Star song. So we do that for at least 20 seconds, washing our hands with a antimicrobial or antibacterial type of soap, and we do that with as hot a water as we can. We can use waterless soaps. There is some downsides to that, though. They are highly alcohol based, so unfortunately that usually dries out the skin, allowing the skin to be, after a while, broken down and dried out and kind of being like an open cut where we can get germs into it, or they can hide in certain areas with the cracks and crevices. After a while, too, it has been talked about. I haven't read any of the studies, but there's been discussion on killing good bacteria. It is great if you can't wash your hands. It's a nice stopgap to hold you over till you can get somewhere and wash your hands. But remember the downsides to the waterless soap too. It doesn't replace hand washing. It just gives you a little stopgap there till you can get to some place where you can wash your hands. Along with washing your hands, remember when you go into the bathroom, you should have the water running. Towels accessible so you can just grab the towel, wash your hands, rinse them off, grab the towel, dry your hands, shut off the water, and then use that to open the door. Now, most of you have, when you go around to different places, you see the different types of, and you could call them engineering controls on how we have all those wireless. You put your hands under, the water comes out. You put your hands in front of the towel dispenser, and the towels come out. And the doors are designed to be pushed out from the inside, as opposed to the other way around. So you could look at these as engineering/work practices that help prevent the spread of disease. The other thing is immunizations we can get. There's a bunch of different ones out there. We start with our hepatitis B one, where you get the 3 shots. Once you get the 3 shots, you get the titer test, and you determine if it's taken with you. Usually after the 3rd shot, 96% of the people are, in fact, inoculated. This is yet another layer. And one thing we found is the more layers you have gives you a better chance of protection in case one of those layers of protection fails. So that's one. There's a bunch of different other ones out there. When 9/11 hit, we had the ones we were worried about, smallpox. So there are some immunizations out there, vaccines you can get that allow you to build up a resistance or protect you if you do come in contact with some communicable diseases. The Ryan-White Act. We all remember this. Well, we sometimes do. The Ryan-White Act was enacted from a child that contracted HIV. He got it through a blood transmission, and after he got it, nobody wanted to let him in school. Nobody wanted to be around him because they were absolutely concerned that they thought they were going to get it. It was back when HIV wasn't as well known as it is today, and people didn't understand how it was transmitted and that you could shake somebody's hand and not contract it. So a lot went on there, and after, unfortunately, the little boy died, legislation went into effect. A lot of it dealt with education and educating the public on how you could contract HIV. The other part of the act that really pertains to us a lot is the emergency responder part of that allows us, if we have some type of an exposure, that we can get treatment. We can have the blood tested. We can find out if they have something and what precautions and medications we can try to take to prevent or reduce the risk of us contracting that disease from them. Now, it takes into consideration the patient's the patient's privacy, because we have to worry about that with HIPAA. However, it also protects us since we're out there putting our lives on the line, potentially getting one of these diseases. One of the things I have found through experience with this is you have to report this to your officers or infection control person in your organization, and they have to reach out and have some type of relationship with the different hospitals and their infection control people. This can be important because not everybody understands the concept and this part of the act. So pre-planning and having this stuff set ahead of time, if there is an incident, what you're going to do with the different hospitals is very important and beneficial to everybody. Now, talking about that, what's a exposure versus an incident? An exposure would be one of those things where we have that broken skin. Blood or body fluid gets into our mucous membranes. That would be an exposure where it got into our bodies. An incident might be getting blood on your coat or on intact skin. Though definitely can be scary, definitely could have some concern there, it's not necessarily a true exposure. Either way, you need to document that to protect yourself. You need to let your supervisor know. Let them know what happened. They can make the determination, and I know through Chief Midori, she's always concerned about her employees with this stuff. She knows what it's like. I know she's had instances where she's contacted facilities with different incidents that have happened, so she will take that spot as far as being your advocate and making sure that things get taken care of the way they are so you can have peace of mind. The diseases under the Ryan-White Act, they're listed there on the screen. Some of them pretty common. We understand them. We've heard of them. Others maybe not so much. Your TB, HIV, hepatitis B, rabies, meningitis, pretty much heard of a lot. The other ones not so much, but they were on the books. And let's face it, even though we might not be as familiar with them, we have reemergences of these diseases and other ones. We've heard recently of other ones that haven't been out there for a while, whether it be smallpox or other diseases, do make their way back. So we also need to be aware of that, and like I said, these are the ones that are listed under that act that are considered highly contagious and covered under the Ryan-White Act. Alright, now we're going to get into the different diseases, kind of wrap it up with that. Just some of the different things, how they're transmitted, some signs and symptoms that you might see, and what you should probably make sure you protect yourself with. We'll start out with tuberculosis. I know it's bloodborne, but this is a communicable disease or a contagious disease. We have airborne. It's airborne. We get it through inhalation. Signs and symptoms of somebody that has it could have the night sweats, weight loss, fatigue, bloody cough. These are symptoms that are related to TB. The one that kind of stands out for TB is that bloody cough. The other ones, and you'll see this later on with some other diseases, are flu-like symptoms. So again, you don't know what this person has. You might think they have the flu. They might have a common cold. They might have a virus of some kind. But nothing that, could be a contagious disease, but little do you know, they have it. So again, this is why we're taking those universal body substance isolations, precautions, to make sure we don't get that. In this case, being airborne, mask on the patient and you. Ventilation in the back of your ambulance, and it's also said that ultraviolet rays or fluorescent lighting can help kill the airborne tuberculosis disease as well. How do you know if you've come in contact? Well, we have those nice little tests that get done. The MAN2 test, the needle where they inject a little bit underneath your skin, it swells up. In 2 days, you go get it read by the ER, and barring you don't have that raised area, the red symbol, you're good. And usually healthcare providers can either have it done every 6 months or a year, depending what the risk and frequency is of potentially coming in contact with somebody that has TB. They also can get a chest x-ray, because once you get the MAN2 test and it shows positive, even if you don't have TB, you're done as far as the MAN2 test goes. You can't get another test because it will always show positive. So you may need to get a chest x-ray to make sure that you don't have it that way. So there are the two different tests and when you would have one or the other. Alright, HIV or AIDS, going back to the bloodborne end. Signs and symptoms, as you see there, again, mostly flu-like symptoms. One of the things that you see later on is the lesions, and that's been a telltale sign prior to this. Basically in the early days of HIV and AIDS, when that was prevalent, was one of the unique or more unique signs that they had. It's a breakdown of the immune system, so you end up you're dying of diseases your body would normally fight off. The incubation period, as you can see there, pretty extensive, 1 to 10 years. So for up to that year period, you're not even sure if you have it in your system. You're constantly getting blood tests done to verify that. And it could be in your system up to 10 years before it even has any outward signs that you have it. It could be active in your body, but you're not showing any signs or symptoms. It can be detected in blood and urine that you have that, but like I said, it could take up to a year before you actually show it in your system. MRSA, another 1,000-point question on the Bloodborne Jeopardy game. What does it stand for? Methicillin-resistant Staphylococcus aureus. Yes, some are very have expertise in this in our area. It's transmitted through contact from person to person, but it also can be airborne. There's a strain that is airborne. It's basically a staph infection is very resistant to antibiotics. Usually those that are chronically ill, have long hospital stays, it's a real bad staph infection, and they're usually the most susceptible. For the most part, those with a good immune system aren't affected as much by it, but we do see it prevalent in, or we did for a while there, and then haven't heard much about it, where those that went to gyms and shared toiletries and maybe didn't wash down that gym equipment were getting it a lot. So there was another strain that wasn't as strong, but it was being passed in through as a contagious disease. Not as strong as the hospital stay chronically ill one, but another strain nonetheless. Hepatitis B, here's a big one. This is the one we talked about that you can get that vaccine for, that 3-shot vaccine that you're eligible for as an emergency responder. It affects the liver, can be contracted through sexual contact, sharing needles. Mothers can give it to their unborn children as they pass through the birth canal. And you can also get it through blood transfusions, though very low risk here because they check the blood so extensively these days. Signs and symptoms, what are they? Pretty much the same as we've talked about before, flu-like symptoms, but usually the one, and it's a little bit later sign on this, is the jaundice or the yellowing of the skin because it affects the liver. So that's another sign that you'll see out there. The hepatitis B vaccine, like we said, 3 shots. That's the standard routine, but I have been told that if you can get all 3 shots within a year time frame, then you'll be, 2-year time frame, you'll still be okay. But again, that titer test is really what tells you if it took or not. How long does it last? Well, that's the big question. Nobody knows. We initially were told, 5 years, and then you got to get the boosters. I've had mine for well past 5 years. Won't tell you how long, because then I'll feel old. But anyway, it depends on the person. The only way to tell is to, again, get another titer test. And that'll let you know if it's still active in your body and you're protected. You may need to get a booster shot, and again, then you'll have that titer test to verify if it worked. All right, the newer one that we heard out there about a year or so ago was the Ebola. We're all worried about Ebola. Ebola was coming back. It was very strong over in Africa. The different countries you see there were the big ones where there was an epidemic. It does change from time to time. A lot of it's been eradicated in some of the different countries. You can go to the CDC website and find out more about that, where it is active. We did have some cases in the U.S. All were treated and under control with people. They were using the actual blood of people that had it and then got through it to help out with other ones. So it did have a good, in fact, we're bringing people over for treatment because things were working so well with the treatment over here. Things have settled down with that, thankfully, and we didn't see an epidemic or anything over here like a lot were concerned with when it first came out. Signs and symptoms, 100.4 temperature. I'm not sure exactly where they came up with that exact degree. I'm sure it's that or higher, but that was one of the things, having a low-grade fever, headache, vomiting, weakness, muscle pain, diarrhea. Again, all that being flu-like symptoms. The big unique thing here, like the yellowing or jaundice of hepatitis or the lesions with HIV, is going back in that sample history, events leading up to. Where were you in the past 21 days? With 2 to 21 days being that incubation period, Did you travel to one of these countries where it was widespread? And that's where the one of the more unique signs and symptoms came out. Is spread through direct contact. It can also be through water droplets from speaking and so forth. So droplet precautions were one of the big things when this first came out as well. Wearing gloves, gowns, masks, again, to protect yourself from that potential entry into the body. You have the patient that exhibits the signs and symptoms. Now what do you do? Get a hold of the Department of Health. And again, this is if they met those criteria where they were to one of these countries within the past 22 to 21 days and so forth. This is the steps you would take. Isolate that patient, again, to protect from yourself and others. Proper PPE that you're going to wear. 2 to 1 days. We said that there's no vaccine at that time when this initially came out, pretty prevalent. Anybody know where it was originally discovered? This was a trivia question too we had. The Ebola River. The Ebola River in Congo. Now you feel so much smarter, and you'll be able to win that question on Jeopardy. Alrighty. The important thing about this, like we said before, we must protect ourselves. We must make sure we go home to our families and make sure that we're not going to be bringing these diseases home, either for us to have or to transfer to our families. Wear your PPE. Use those universal precautions. Work practices. Wash your hands. The engineering controls. We have them out there for a reason. We don't have to buy them. They're out there. We just need to use them. Take the precautions. Be paranoid if it makes you feel better. I'd rather be paranoid and then come home to my family and not have a disease, as opposed to being laissez-faire and not worried about this stuff, and next thing you know, I'm bringing a disease home that could kill somebody. We don't want to be sick to begin with, even if it's not a contagious disease. By wearing our universal precautions, washing our hands, and practicing these steps, we can reduce the amount of times we're sick as well. Alright, hopefully you got something out of this. You were refreshed. We're going to have a little quiz at the end that you can take. Again, nothing big, nothing you haven't learned or saw before. So again, take care of yourself and be safe.